Hey, welcome back, everybody. We're so happy to have Neurosurgeon Dr. Reza Shahim with Arkansas Surgical Hospital here talking microsurgery and back pain today. Thank you so much for coming back in. Great to see you as always.
Good to see you, Chris.
Thanks for taking some time out of the OR to explain what this is to our viewers, because this is something that I think has been around for a while now, at least, but at the same time, it's getting so much better and less invasive. So what is microsurgery, and how would you put it in simplest terms?
So thank you for having me. Microsurgery is a small incision surgery that's done in the spine to take the pressure off of the nerves. It's also considered minimally invasive surgery, where we make a small incision. There's less trauma to the soft tissue and muscles. Most of these surgeries are performed in neck and back for pain, and the surgeries are performed to take the pressure off of the nerves, reduce back pain, neck pain, sciatica. The outcomes are generally good because patients recover quicker. There is a less chance of infection and bleeding and other complications. The surgeries can be performed as an outpatient, where patients can go home the same day, or they can spend the night and go home the next day.
Wow.
So generally, patients recover quicker.
Whenever it used to be the surgery needed on the back, and it was more invasive when you had to really open things up. What's the time difference on those? I don't know, a surgery that it used to be done like that compared to a microsurgery now?
So when microsurgery basically has less pain associated with it because we do less dissection. We pull and push tissue a lot less than a larger surgery, a larger incision surgery. So again, since there's less trauma to the tissue, less blood loss, so patients generally recover much quicker. The swelling from the surgery generally goes down in a couple of weeks. And the disc and the spine healing may take about a month. Most patients are able to go back to work about a month if their job is not heavy manual work.
Okay. Do you see this becoming more and more common just with our lifestyles and the way that we live these days? Is this becoming all too common out there that more folks are needing this type of surgery?
So neck and back surgery and neck and back problems are very common. We will all have some neck and back pain during our lifetime. Very few of us will require surgery, but as people smoke more, do heavy manual labor, or have obesity and diabetes, they'll probably have more incidence of neck and back pain that will require surgical treatment. And yes, you'll have to change your lifestyle long-term to improve the outcomes. But it's become a very common problem. It's very similar to a knee injury or a hip injury, where it causes chronic arthritis and chronic pain that can be fixed surgically.
One of the benefits, too, is scarring. I'm sure it used to be a big scar when it was more invasive. Now, how big is the incision made for something like this?
So for a microdiscectomy, which is a small incision to trim part of the disc, which is the cushion between the vertebra, generally about an inch, inch and a half. Some of it also has to do with the patient's size. Larger patients may require a larger incision to do the procedure. But again, I think it's fairly small surgery as opposed to what we used to perform in terms of exposing the spine.
Okay, less recovery time. Excellent. What about any need of future surgeries? Is this one that helps immediately in terms of maybe getting to the problem immediately?
That's right. So there is always a risk of a recurrence or re-injury. Very similar to, again, if you get a knee injury and then you get another injury. The recurrence rates are small, perhaps 10% or less for many years. I usually recommend these surgeries in patients after they have failed some conservative management. That includes medications, anti-inflammatory meds, physical therapy, lifestyle modifications. We perform injections, for example. So I will like to offer most non-surgical treatments to almost everybody that we see. And then the patients that fail that are a candidate for surgery. And yes, there is some chance of recurrence and re-injuries. Again, if you modify your lifestyle, lose weight, reduce smoking or smoke cessation, these things will reduce your chance of recurrence long term.
All right. Thank you so much for coming in this morning and explaining all this to us. If you feel like you are in need of something like this, if you've exhausted all other methods and want to talk to a surgeon who's ready to help you, you can call Arkansas Surgical Hospital. The address is on your screen. The number is on your screen. Give them a call today. Get a consultation and hopefully get better soon. We'll see you next time.
Thank you.
Thank you. Coming up next, we're talking about